Now that we're in the last month of 2017, many of us are looking at reviewing our health insurance and our drug coverage for the coming year. Wanted to spend a few minutes talking about a number of ways that we all might be able to save some money for the coming year on drug costs. Before we do that, my name is John Lorscheider. I'm a PrevMed patient and a follower of Dr. Brewer's YouTube channel. Wanted to talk about how many of us can possibly manage our prescription drug costs better than we're doing so far. Much of this I've learned on my own, much I've learned from my neighbor, Dan, who happens to be a lifetime insurance broker. As we're in the last month of the calendar year, we have about less than a month to look at what we're going to have next year for healthcare and drug coverage. Good opportunity to explore options. These options are applicable to people of all ages and all income levels for that matter. And what I found is there's a lot of savings to be had with some of these ways. One of them is we all have to have a qualified drug plan under the Affordable Care Act. These plans have to be qualified. They have to meet the guidelines of the Affordable Care Act. It's mandatory. You don't have this coverage, you can be financially penalized. Interesting thing, some of these programs are very inexpensive. In Wisconsin, where I live, we have one called Senior Care. My wife uses it. It costs $30 per year. Coverage is based on income level. Interesting thing is, everybody qualifies. Higher income people, you get less initial coverage. In other words, your drug coverage won't kick in until you spend so much out of pocket on drugs. You can get more initial coverage if you want to spend higher initial premiums. My suggestion is you buy the cheapest qualified program you can get that's qualified, but don't use the card. We'll talk about that. We use this card with drug discount cards like GoodRx or RX Valet. We're going to talk about those too. Most of these discount programs are designed to work with generic drugs, but they all cover brand name drugs as well, just at a higher cost. You can also buy online from pharmacy checker approved vendors. What we're trying to do here is to save you money and make sure you get the prescription medications that you need. There's some good ways to do this. So how do you know your state has a state-sponsored assistance program? You can go to a website called the National Conference of State Legislators. Just Google NCSL. It will talk about these 38 states, roughly, or maybe a few more by now, that have state-sponsored programs. Initially, these were designed for lower-income families. It gets them drug coverage, but it's available to everybody at any income level. So see if you can get one. Get a state-sponsored program. Don't spend much money at it. You won't get a lot of coverage for it. And then, now that you have that coverage, go and sign up for a discount card. GoodRx happens to be one of them. It's totally free. I like it. I've been using it for years. You get 90-day supplies of medications rather than the 30 days private health care insurance tries to get you to buy. It covers all generics, very low copayment. When I use this, invariably I would say it's 90% of the time my GoodRx card copayment is lower than my private health care insurance, and I have pretty good private health care insurance. It also covers brand name drugs at a higher copayment. Almost all pharmacies take the GoodRx card. Call in advance, make sure they do. If not, find one that does. Walgreens didn't take it a few years ago. I switched to CVS. Now I hear Walgreens might be accepting GoodRx again. Or you can go on GoodRx.com, fill out a few obligatory questions, print yourself off your discount card, go down to the pharmacy, save some money. Basically, your pharmacist, I should say your primary care provider will call in your prescription. You go pick it up, just show the card, and make your low co-payment. They have a great iPhone app for both iPhones and Androids. You put in the medications that you take. It will search on a GPS. It'll tell you every pharmacy within a 10 to 15 mile radius what the price is for that medication at that pharmacy. You can pick the one you like. Not obligated to use any one pharmacy. Another card, RX Valet. RX Valet costs a $25 a year membership. They give you the 90-day supplies versus the 30-day, just like GoodRx. Covers generics and brand names. Accepted it. They claim 60,000 pharmacies across the country. They claim every one. You buy it online. You make your co-payment online. You go down with your receipt and your prescription. You pick it up at your local pharmacy, any one you want. The prices don't vary from pharmacy like GoodRx. Basically, it's a flat fee. What's really unique about RX Valet, and I haven't used it yet, but I'm going to, they cover diabetic testing supplies. In other words, your test strips for your glucometer and your lances are probably going to be covered to some degree. Don't know how much yet, but if it saves me half, I'm damn thrilled. I use an Abbott Freestyle Light like many people, and 100 test strips run me $167 in my neighborhood. So if I can get some of that back, I'm pretty happy. RX Valet, you go to their website. Again, very simple. You sign yourself up for a membership. You put in your credit card for $24.95, print yourself off a card. They also have a nice smartphone app that you can go and do many of the things you can with the GoodRx app. Another way you can save money. This is if you were prescribed a brand name drug, an expensive drug therefore, probably going to be high up the formulary on your drug insurance program, a tier 3 or a tier 4 drug, going to run you some money out of pocket. Go to the drug manufacturer's website. Invariably, I've yet to find one that this doesn't work. You go to that prescription drug manufacturer's website and look for their assistance program. You have to answer a few obligatory questions. Basically say you're not going to take this free drug and go out and sell it to make money on it. That seems to be the one they're pretty keen on. Applies to brand name drugs with no generic equivalents. Like I said, the drugs are high up the formulary, tier 3 or tier 4. They all have high monthly co-payments, but these manufacturers will accept whatever your insurance, your private healthcare insurance, whatever it offers that manufacturer, they're taking it, and you're going to walk out with a zero co-payment. So I take Xarelto. If I paid cash per month, it'd run me about $1,200. If I use my GoodRx discount card, $440. If I use the manufacturer's zero co-payment, I walk out with it for free. Nice deal. Go to the Xarelto website, for example, they'll tell you about it. You go to anybody's website for brand name drugs and look. You'll be surprised. It'll probably be there. Another way you can save good money, this is pretty shocking. Go to a website called pharmacychecker.com. Pharmacy Checker does not sell drugs. They rate online pharmacies from around the world. It's a great website. I've used it numerous times. Basically, you go down here, you enter the name of a drug, probably a brand name drug, one that's going to cost you some significant money here in the United States, no matter what route you go to. And what you'll get is a printout. I happen to use a drug called Xarelto. So I, for sake of example, put in Xarelto, 20 milligram. I went over here and I clicked the lowest price to the highest price, and there it is. I used a pharmacy, for example, called Price Pro Pharmacy out of Vancouver, British Columbia, the second one right here. I can get a 3-month supply for $150, $50 a month. So if I use cash, I would pay $1,100 to $1,200. If I use a GoodRx card, I pay $440. If I buy online, I can get it for $50 a month. So the question that I will answer the question you're probably wondering, am I actually getting what I'm buying online? Am I getting the drug I need? I bought some Xarelto, and I bought it online through Price Pro Pharmacy out of Vancouver, British Columbia. It came in factory sealed boxes from Brewer Pharmaceutical, and it didn't come from Canada. It came from the country of Turkey. So first thing I did is I copied off the lot number and the code, the manufacturing code, and I called Brewer Pharmaceutical in the United States, got a hold of customer service. I gave them the lot number and I said, is this made by Brewer? And they checked, came right back, said, yes, it is. It's made out of the United States, as they do many of their drugs. So these drugs made in other countries are dirt cheap compared to what we will often have to pay here. I saved an enormous amount of money, but I have to do a few things. I have to be willing to accept a shipment coming that takes several weeks, but for me, the savings is worth it. I'm glad to do it. What Pharmacy Checker does is they go down every one of these several hundred pharmacies on their website and they rate them. For example, they give an overall rating of 5 check marks. That's as high as you can get on pharmacychecker.com. And then these are rated in a lot of different categories, and they have to meet all these criteria. And it goes down, and the page keeps going. And they're rated on everything from quality of service to responsiveness to privacy to timely shipments to number of complaints received. Obviously, when you can go and have a resource like that where you can buy in greater confidence, it's worth it. Is there a risk? Yep, there's some risk involved, but I think it's minimal. Most of the bad companies have been flushed out years ago, and I haven't been burnt, and I've saved a lot of money. So I hope this information is helpful to you. I hope you save money. I hope by whatever means you do, you get the pharmaceutical drugs you need. If you have questions, please ask below. I'll respond. I'll try to point you in the right direction of getting the drugs you need at an affordable price. Thank you.